you got a full-time job now because now you got to rank your program, and you got
Yeah,
probably you have to make a decision on all 10 of these. And typically what happens is after your interview, some of the ones that were your number two or three or fourth choice or ranked, maybe that has changed after the interviews, right? Because
%.
this is your time to really investigate the programs because you got to choose the programs too, just like they have to choose you. So, and that's why it's so important, and we talk about it in our training that we do with your interview process of how to make sure that you're getting the most out of the application process related to your job as a candidate, which is you're interviewing the programs too to gather your information so that you can make your final decision related to what programs and most importantly having to rank several programs. So tell us a little bit about how you went about ranking the programs and again and maybe tie back into the reasons that you selected certain programs, but just share with how you went about formulating that rank list because that also can be a challenge for many people, especially if you have a multitude of programs that you've interviewed at.
Yeah, it was very challenging, and especially like referencing what you were saying, I would leave some interviews feeling completely different about a program than I went into it. And so if I would have shown my like past self the rank list, I wouldn't have thought. I would be like, "Why? There's no way you ranked it that way. That doesn't make any sense." Because I had certain ideas of how programs would be, and then certain ones it just comes out completely different. And so again, like to what you said, it was thinking about the different things of why I applied to them in the first place. So like how stringent or rigorous is their didactics? Because especially being in my pre-doc program, we have very, very rigorous didactics, and I loved how that shaped me into the provider that I am right now. And so being able to continue that within the specialty was something I found important. Also, like how much craniofacial experience. Some have like seminars and you have a rotation of craniofacial orthodontics, and some you're on like weekly. You have patients of your own who are have these craniofacial abnormalities that you're treating on a regular basis. And so being able to know which programs have a lot of exposure for that, and then just like what is the reputation of the program in terms of how much clinical exposure they get and what the magnitude of that clinical exposure looks like. And so being able to get a feel of that, talking to the residents at the interviews, and a lot of the programs will give you numbers about how many cases they see, what types of cases, what is the breakdown and percentages of each type of the treatments that they have for their patients. And so all of that going into one, along with the cost associated with the programs, was something that I put together. And it was lucky enough that like it was like half and half. Half of the programs were around the same price, and then the other half of the programs were around like the same price of a different bracket. So it came down to those things essentially. It was the cost went down the list, and then all of those other intangible aspects of it that went into it, and then overall how I felt energetically about the programs, like emotionally, how do I feel like I would be there. Um, and so it was like this weird way of going about it. I had like a weighted point-based system where I had all of the different characteristics of what I would want out of a program. I rated that in terms of
Yep.
importance, and then
Yep.
used that to weight each of the like what I thought each program had. So I rated the program, like how much they fulfilled that, and then used that and plugged it into how much it was weighted in my importance, and then use that and also to give me sort of a metric to know more so objectively where I stood on the programs, to be able to support how I emotionally felt about them.
Yeah, and so people you people hear now that it's not a hard process, but it's not an easy process, and it has to be intentional, right? Because this is where you're going to be for 2 or 3 years, and you want to be able to make the best decision for yourself based on all those factors that you mentioned, but most importantly, your mental health and emotionally, and how you feel about the program, because you will be there for you know almost 1,200 days if it's a 3 year program. That's go
Definitely.
that's your home. That's your spot. So you want to make sure that it's uh an environment that's conducive to your educational, but also your emotional well-being. So a lot of things to go into about selecting and ranking programs.
Next assignment is go to the next video. Go to the next video right now. Go, go, go. Love, peace, and smiles. Go to the next video. Go to the next video.